We have cardiologist Dr. John Kennedy here to tell us more about Dr. Ordon's heart, the tests that we should all consider. Thank you for being here. Doctor.
Doctor
And patient.
I call him the king of hearts over here.
Well, the first thing I want to ask you, Dr. Kennedy, is I think Dr. Ordon was smart to seek guidance from you. But who at home should at least think about talking with their primary care doctor in terms of seeing a cardiologist?
People that should be thinking about coming to see a cardiologist are people with risk factors, and there's 5 of them. High blood pressure, high cholesterol, diabetes, do you smoke cigarettes, and whether or not you have a family history of premature coronary artery disease. Did your dad have a heart attack before 50, and did your mom before 60? If you have any of those risk factors, you should actually go see at least an internist, and a lot of times you'll be referred to a cardiologist. When you see a cardiologist, we really pick the test that's appropriate for the patient. And for anybody that can exercise, I mean, Drew's a great example. Anybody that can walk and climb a flight of stairs or is doing their regular exercise routine and notices a change in their symptoms. Drew said he was feeling a little short of breath when he climbed a couple flights of stairs. That's important because that tells us what test to do.
Let's walk through and show people exactly what you're looking for.
Yeah, so here is an example of a heart, and what we see in our heart is we have 3 main arteries. There's an artery on the top at 12 o'clock, an artery at 3 o'clock, and an artery at 6 o'clock. And with the stress test, the stress nuclear cardiology study, we see how the blood fills this heart muscle when we put the heart under stress. That's important because the way these arteries supply the heart muscle, we can actually create a change in blood flow to the muscle when we stress the heart. It's sort of like a supply and demand imbalance that we can see. This is an example of looking down the barrel of the left ventricle, which is the main pumping chamber of the heart. Now imagine, there's an artery at 12 o'clock, that's the LAD, there's an artery at 3 o'clock, which is the circumflex, and there's an artery at 6 o'clock, which is the right, usually the right coronary artery or the posterior descending coronary artery. Now we stress the heart, we increase the demands of the muscle, and imagine there's a blockage in that top artery. The heart muscle can't be supplied enough with blood when the heart's under stress, and we see a dropout. We see this big, lack of orange in this area, which tells me there's a blockage in that artery. The other thing we see if we look closely is the heart gets bigger. That means the heart is dilating because it's under stress and it's not getting enough blood to that muscle when it's stressed.
And that's precisely why some people will complain of exertional shortness of breath, exertional chest pain. It's because when you're putting the heart under stress, it needs more blood, it needs more oxygen, and it doesn't always fill the way it should. But our own Dr. Ordon had these concerning symptoms. So this is the nuclear stress test is what you did for Dr. Ordon.
That's exactly right. And Drew's in good shape. He exercised to a level that's, above average for his age. How old are you, 42?
Thank you. The Botox is supposed to be working.
His heart rate and blood pressure responded pretty normally. He had a little bit of a hypertensive response to exercise. But when we looked at his heart, and again, if you think of the heart looking down the barrel of it, and I'll just show these top images, this is his heart at rest, and this is his heart stressed. When we push him to a really high level, running up a treadmill, running up a hill, you can see that there's perfect distribution of this orange, which means that all the blood vessels are supplying that muscle perfectly. And the other thing we see is that his overall contraction of his heart is also normal and improves when we push his heart under exercise. So Drew actually has a really, really good heart. You got a heart of gold. And
That's good news.
It is good news. And the other question, of course, I would ask you, just like any other patient, is how are your symptoms now?
I feel good.
You feel good, kind of back to baseline? Because a lot of times people will have subjective shortness of breath that it turns out to be nothing, but sometimes it'll be underlying heart disease. But if you are at home and you're having worsening shortness of breath with activities, there are other causes of shortness of breath. It could be fluid on your lungs, pneumonia, it could be a blood clot. So if you were getting worse, then you'd say, okay, well, now we know it's most likely not heart disease, but let's now look at other possibilities for your shortness of breath. But you're saying that you're better, so you can say, okay, now I'm reassured.
that's right.
Dr. Kennedy, thank you. Dr. Ordon, glad the test turned out well.